KRCH represents the Kauai River Christian Hospital, and it's located in Thailand in a province called Kanchanaburi, near a village called Sankalaburi, very near the border with Burma, or what they call now Myanmar. It's evolved into a hospital that cares for the thousands of refugees who have fled the border from Burma to Thailand, fleeing the oppression of that government. The population is always changing as the people come from Burma, where there's just horrible human rights abuses over there. And two is it's in a tropical setting, so they're on the cutting edge of dealing with tropical diseases. Malaria, tuberculosis, and of course HIV/AIDS. So unlike more institutional hospitals, they're out there where it's really needed. Well, I was there personally and was able to see the hands-on care that are given these indigenous people for little or no cost, and compared that to growing up in Newport Beach, right across from Hoag Hospital, where you don't want to go there for fear of the expense. In other words, it's where the rubber meets the road for people who can't afford health care. And what we're trying to do is to raise funds to just give them the basic medical supplies that they need to keep that good work going. So that's why I'm involved. So it's a matter of knowing specifically that your dollars are going to go right to the hospital. We don't have a big organization. It's just the appeal of people who have been there and seen the need, and it's on their hearts to do something about it.
They need supplies desperately. They don't have really what they need to be able to do the surgeries that they need to do that are billable, that would actually bring in more money because they don't have the equipment that they need. For instance, to run the lab tests that they need, to do simple lab tests that would have a 20-minute turnaround time, they have to wait 3 and 4 and 5 days to send those lab tests out to get them back. And those are things that are critical to treat patients. And so those are simple things that they need, blood pressure monitors and a ventilator that they need for the operating room right now that would allow them to do more surgeries, to do surgeries quicker so they could do more surgeries and shorten operation times and things like that. Just basic equipment that they need that would make the hospital run more efficiently. They don't have access to them because they don't have funds. It's a 40-bed hospital, meaning that they have 40 inpatient beds. They have a 2-little-bed outpatient/ER room. So those patients kind of come in and out all day long. Those are the quick turnover beds. Then in the back of the hospital, they have room for 80 more patients, which are their long-term beds. And those are the patients that come in that have tuberculosis, malaria, HIV/AIDS, that need long-term care and treatment. A lot of those patients are from Burma. They can't come back and forth across the border for their treatment. They can't afford their treatment anyway. So they come oftentimes with whole families staying in one room. 25,000 outpatient and ER patient visits a year is a lot for that little tiny hospital. It's not very big in terms of square footage. That's a lot. Well, actually that's, part of the problem and why they're financially, having a problem, which is why we're raising money. 60% of the patients actually can't pay their bills. They just can't. So they receive a bill, if indeed they even have an address, for up to 18 months. And then after 18 months, the hospital will just write off the bill. They took things out to the maintenance yard. They fixed what they could fix. What they couldn't fix, they threw away. They sent out SOS letters to their supporters saying, if you've got anything that's expired or that you're going to throw away from other hospitals, please, we need these supplies. So what they have is literally jerry-rigged, duct taped together. I mean, it's really sad. It made me as a nurse cry when I saw some of the equipment that they're using. There's the big ticket item that Dr. Scott said would be his biggest wish, probably the most expensive thing on the list, would be the commercial washer and dryer for the laundry in the hospital, because right now they're literally washing out the sheets and the towels with a hose, getting the chunks of the feces and blood and the infectious waste with a hose, washing it down the drain, dipping in baths of bleach water, and then it goes into a regular house kind of washing machine like we would have in our house, and then it goes and hangs on a clothesline, and that's it. That's what they have for all the laundry that I told you about, the 40 inpatient beds, the ER turnover beds, and then the 80 beds of the residents. Immediately they need stethoscopes that work, and they need thermometers, and they need suture material and blood pressure cuffs and those small ticket items too. When we're blessed with much, we're required to bless others and give much, and this is, I'm happy to do this, to help and raise money or do whatever I can do, even taking things from my own facility when they're available and they're going to be thrown out or given away, and do what I can do for this little hospital. I just feel an affinity for these people and for the staff that's there, and I just immediately loved them and loved this place, and I want to do whatever I can do, whatever God puts in my path to bless them with. That's what I want to do for them.